Okay, Priyanka, thanks for joining me.
Absolutely, Maddie. Thank you for having me today.
Yeah, and I want to introduce you. So, everyone, this is Priyanka. She is the clinical director for Advantage Point Behavioral. And I know, Priyanka, we've had multiple phone calls now. This is our first Zoom introduction to see each other, but we've had multiple conversations because we're both working in the same space. And so, do you mind give a quick bio on Advantage Point Behavioral?
Absolutely. So, what we do here at Advantage Point Behavioral is we provide pre-surgical behavioral assessments for obviously bariatric surgeons and their patients through telehealth, through a HIPAA compliant platform. So we help patients prepare mentally for the challenges, related to weight loss surgery. And we also work now with bariatric counseling. So if a patient needs any kind of counseling before the surgery, just to kind of stay on track, and even after, all of our therapists are trained and specifically in addressing those issues with the patients. So we are in over 48 states. And so we, have a very big market. We have several bariatric surgeons who use us currently. And so far, so good. And patients love it because they don't have to leave their house. And surgeons love it because we do have a quick turnaround and we're able to work with the office, really closely on getting them what they need, especially with patients who maybe have like a surgery on the corner, or some psychologist that's local is taking, months or days to get the eval done. So that's kind of why we're here, is to kind of provide access to care through technology.
Right. And you guys are also a pretty big player in doing this for, let's see, you work in, is it pain or spine programs?
Yeah, spinal cord stimulators
Yeah.
and pain. Yeah, pain. So that market is, it's obviously it's lots and lots of doctors. So, orthopedic surgeons can do those implants, anesthesiologists, physical medicine and rehab doctors, and then of course interventional pain doctors are probably the highest percentage of docs who perform spinal cord stimulator implants.
Gotcha.
So yeah, so that's so yeah, that is another market, and we're growing like crazy in that market as well.
Yeah, I can imagine the quick shift to telemedicine was probably not a bad thing for you guys.
Yeah, we've been in telemedicine since we started, but
Right.
yeah, it definitely, especially with some of these smaller practices that, were doing things the old school way before COVID, and that did not work out so well.
Right.
So they definitely have jumped to the other side now. So
Yep. Yeah. So, behavioral assessments or psych evals, that is not our specialty at Boost, but what we are keenly interested in is what is any tool or resource that can remove barriers to care, can get people in quicker, or can make life easier for the staff inside the clinic.
absolutely,
So
yeah.
if you were introduced to a bariatric clinic right away and they didn't have any idea how you guys did what you did, can you explain that to me? How do you get these evals done for a bariatric clinic?
Yeah, absolutely. So there's two ways to go about it. We have a patient coordinator department, and also, of course, me as a clinical director. I'm available, anytime via email or phone call. But the patient can just go to our website, so we can provide the doctor a what we call patient registration handout. They give that to the patient. They go to our website, and all they do is register. What that means is, putting in their insurance information, their demographics, taking a series of assessments, which allows the clinician to look at those assessments before they see the patient. And then once the patient schedules their own appointment, and they get matched up with a therapist based on their insurance and what state they're in. So, for example, if you have a patient in North Carolina that has Blue Cross Blue Shield and they want a 7 p.m. meeting on a Wednesday night, that is very possible because we do have those slots. We have the inventory, we have the therapist to do it. So they pick their time, they pick their insurance, and they get matched up with the therapist that can see them at that time, that's in network with that insurance.
Mhm.
And then that's it, and they're ready for the interview, and they log on through a link. What we use DoxyMe as our platform. It's a HIPAA compliant telemedicine software or website, and they just click on the link. The good thing about that link is the patient doesn't have to register or anything like that. We remove that barrier by using Doxy, and they're in a waiting room. They get seen. It's an hour-long clinical interview. Once they're seen, the therapist generates a report within 24 to 48 hours, and then the doctor will receive that report, within that time frame as well.
Got it. So a few of the benefits, 24 to 48 hours, it's done. You guys keep pretty wide slots, so there's lots of time slots available. And I think you mentioned before, you guys have Saturday appointments?
Yep, Saturday and Sunday.
Okay.
Saturday and Sunday, yeah.
Okay. And then as far as benefits to the clinic, it gets people through quicker. There's more open slots. The patient doesn't have to travel, obviously, to get it done. And do you guys also, I'm not familiar with the insurance coverage for this part. Do you guys take care of all of that?
We take care of all of that. That's exactly right. So we verify the patient's benefits right when they register and they provide that information. It's pretty much done in real time. We're very quick about it. Um, and then we let the patient know what their out-of-pocket cost is going to be, so that we do give them a chance to cancel if they want to. We do find that if a patient does cancel for some reason, they usually end up coming back because they're just having a difficult time finding anybody.
Mhm.
But we do take most major payers, like anywhere from Aetna to Blue Cross, all the big ones, Humana, United, Optum, all of that. If we are out of network, it is a $200 charge. But again, that covers the interview, the report, everything. And we also take Medicare in most states right now. So if there's a Medicare patient, what we do is we just bill Medicare, and obviously they probably wouldn't have to pay anything for it.
Gotcha. Okay.
So that's but yes, they are told up front before they're even seeing what their out of pocket's going to be.
Got it.
Yeah.
Just out of curiosity, and maybe you can tell me it's none of my business, but how are you guys going and recruiting these therapists around the country? I'm assuming in every state you have a list that these leads go to, right?
Yeah, so I do the recruiting and the hiring. There's various ways. We have ads out on Indeed. We have ads out on, some of those what do you call search engine type of
Mm.
job things. Also, we just through word of mouth. Some of the therapists I hire, if they have associates that they work with at the hospital or private practice they're with, I've gotten a lot of leads that way. So yeah, there's different ways we do it. And then I just go out and look for them. It's really, to be honest, we're inundated with resumes because
Sure.
now everybody wants to do telehealth, and it's just a big thing now. So there's no shortage of really good therapists out there.
Right. And there's no risk. I mean, you guys have kind of unlimited capacity, or is there a time when you would get maxed
Yeah,
out?
we've gotten to a point right now that we're in a really good place, so a patient can easily get an appointment within 24 to 48 hours.
Okay.
It shouldn't be an issue at all. So yeah, so obviously if you would have asked me this 5 years ago, I wouldn't have been able to say the same thing, but we're very, very buttoned up and in a really good place right now with that.
Okay.
Yeah.
Okay. And working in 48 states, can you share how many of those doing bariatrics in?
I can tell you we work with over about 200 or 2 to 250 practices right now. Pretty much in every state we work with a bariatric practice. I mean, even in North Dakota and even in South Dakota. So
And hospitals as well, or only private practice?
hospitals as well.
Okay.
Hospitals as well. Yeah. Big hospitals as well.
Well, that's great. That was all the bullet points I had as far as questions. It seems pretty cut and dry and simple. So if
Yeah,
somebody,
one of the things I wanted to touch on, Maddie, real quick, because I think it's one of those underappreciated or underrated services that we offer is the counseling part, right? Because problem, with any patient is the pre-surgical they have to do it, right, to get
Mhm.
to the process. Whereas the counseling is more of a opt-in, and but
Right.
I just and I know a lot of surgeons that I've spoken with in the past have shown much interest in their patients, doing some kind of counseling program before and after, because to be honest, that's what helps them keep the weight off in the long run. Yeah, they work with a nutritionist, but we're talking about the psychology side of it. And so we work with them on things like cognitive behavioral therapy, breaking bad habits and thought patterns and things like that. We do um, mindful eating practices. We do a lot of things that are focused just on having the patient stay on track and, with their weight loss, food journaling, that kind of thing. So yeah, I just want to mention that and just let, anyone that's listened to this podcast, surgeons and patients, that is a service that we offer, and it's going to be, we accept the same insurances and everything like that. And again, the patient doesn't have to leave their house for that as well.
Absolutely. No, that's a great point. I'm glad you brought that up. And that makes me think of another question. If, every bariatric clinic you guys go into, obviously the patients are getting this done somewhere else now. I only know of only a couple of people who actually have a psychologist doing this in-house. So what is it typically when you go to a bariatric clinic? What's the pain point for them? They're saying, well, we're getting this done elsewhere now, but why do they end up switching to you guys?
Overwhelmingly, it's turnaround time, for the most part, but then also the convenience. The patient may live in rural, Louisville, Kentucky or something like that, and they're not able to, again, they are struggling with obesity and other health problems. So, them getting to somewhere where they can see a psychologist at a brick and mortar is like almost impossible, which obviously, puts the surgery on hold and things like that. So it removes those barriers as well.
Absolutely.
So yeah, so that too. And I think and I want to, one thing I want to touch on as a therapist is, and this is just a question that is very normal. We get, quite often in the industry is, how can you, sometimes through telehealth, or there's some things being lost in translation because you're seeing the patient through video versus on your couch, or in an office. And I can tell you that, because of the nature of the assessment, again, the evaluations require, obviously immediate attention and objectivity. So we want the patient to feel comfortable, and we promote openness. Whereas in another, when the patient goes to a brick and mortar, they come in with this anxiety. And I'm not saying they don't have anxiety when they see us through telehealth, but I can tell you it's just, there's a little difference there as far as how comfortable they're feeling. And because of the way, we normalize things, it definitely facilitates like them being comfortable. They're on their own couch at home, which they're familiar with. And so
Right.
they're open to like, speaking more about their emotions and things like that. So just want to throw that out there for anyone that has, that as a concern.
Sure. All great points. All right, Priyanka, anything else we need to know before we go?
No, not at all. Like I said, advantagepointbehavioral.com is our website, and our toll-free number, if anybody wants to use us, is 877-583-5633. And that will route you to one of our patient coordinators that can walk you through the process and all that good stuff.
Great.
All
Very
right.
good. Well, I'm going to stop the recording and then we can wrap up.
Okay. Sounds good, Maddie. Thanks.
Thanks, Priyanka.
Uh-huh.